thank you. Thanks so much for inviting me. It's always fun to have the opportunity to talk about health insurance. Most people don't want anything to do with it, but it is one of those necessary evils.
Oh, boy, is it. So let's get right to it, because we want to give folks out there as much information as possible. But we all know, and we have all heard, that ObamaCare is here. California has been working on it
Yes.
for quite some time. So for an individual out there, what does that mean to a 20-something, a 30-something, what does it mean?
Well, what it's going to do is, in 2014, it will guarantee that individuals will have access to health insurance. Right now, if you have a chronic health condition and you don't have access to a group plan, you probably will not qualify for an individual policy, so you will not, by any choice of your own, be unable to get health insurance. And those are the folks that this piece of legislation was really targeted to help cover.
So they will get insurance now under ObamaCare in 2014.
In 2014. Right now we have, there are some programs in place. There are a number of programs out there that can assist. We have, obviously you have Medi-Cal for children. We have the Healthy Families program. There's AIM for pregnant women. We have Indian health programs. We have some guaranteed issue plans that are out there. They are just simply unaffordable. For example, to cover somebody in their 40s that has any kind of health situation or health issues going on, you're probably looking at about $1,200 a month in premium.
Wow.
So,
and that's for someone who's not healthy. And I know for myself, I was talking to you about this off air. I was curious because I had heard under ObamaCare that routine preventative procedures like a colonoscopy or something could be free under ObamaCare. One of my friends told me this.
yes.
So I decided to test the waters and call my insurance company. I was on hold for 2.5 hours.
You dialed that 1-800-NOWHERE number, didn't you?
I did stay on hold for 2.5 hours because I was in my car, hands-free, by the way. I was not driving. And got the guy on the line, and he basically told me, looked at my policy, I'm paying $500 a month, and my husband's paying $500 a month. We are self-insured. And he said, if I were you, I would not give up your current insurance. He said, you may be faced with as much as 3 times that amount when all of this kicks in.
And that's true. And what I think you're referring to, Deborah, is your plan is one of the grandfathered policies, I'm assuming.
Yes,
and those
that's
plans,
the term he used.
yes,
also.
yeah. The non-grandfathered plans do provide 100% coverage for all of your preventive health care. So your annual physical, any of the lab work that's associated with that, all those procedures are covered at no charge. The downfall to that is that costs money. So
right.
Nothing comes free.
Right,
so,
right.
So
somebody's going to pay for it.
It's going to show up on the premium end on the policies that lose that grandfather status. And that's what we're seeing. In fact, I've actually heard that once everything gets implemented, that group plan premiums are probably going to rise about 20%. Individual policies that are non-grandfathered, they're saying could have premium increases of as high as 40%.
Well, I'm curious about that because, my insurance policy goes up. It's like my birthday's in January. It's happy birthday.
Yes.
You're a year older, and you get to pay 20 or 30% more.
Yes. And then on top of that,
every year. So what's the difference?
Yeah. And then on top of that, they'll probably hit you just with a additional increase, not age-based, but just region perhaps based increase. So again, what are we doing? Everybody's going to have access to coverage, but are we going to be able to afford it?
And then we're being required to afford it.
Exactly. So those are some of the things that, yes, everybody will be affected by that. In 2014, everybody is required to have insurance. The penalties, however, if you don't, there's not a lot of teeth in them.
Right.
For example, in 2014, the penalty for an individual who does not have health insurance is only $95 a year. So
it's cheaper to not have health insurance.
Yeah, I don't think that's a huge incentive to run out and
right, and buy
your
health
insurance.
Right.
Likewise, on the employer side, the employer groups in 2014 that have more than 50 full-time employees are going to be required to provide insurance, or again, they're going to be hit with penalties. Or did they call those taxes? I can't remember what it was, you know.
I think some of them are called
some are
taxes.
Yes, yeah. Some are taxes, some are penalties, some are fees, you know,
Yeah,
whatever
right.
it is, it's money out of our pocket, one way or another.
Exactly.
And again, those penalties are $2,000 per employee per year. Well, you break that down, that's less probably than that employer would pay to buy insurance for their employees.
I didn't think of that. Yeah.
So the fear, you know, and this is going to be something that you know, the government's going to have to really closely monitor. The fear is that you're going to see this mass exodus in the employer market. Employers just may throw up their hands and say, great, I can get out of it. Yeah,
I'm done.
Yeah. So the trick is, how do we incentivize people, employers, individuals to really buy into this?
And how do we?
You know, it's a challenge. I've talked with the folks in California that are setting up the California State Exchange, and they don't have all the answers. The key is going to be, number one, to try to make it attractive to the younger folks. Right now, they're going to go, if you have a non-grandfathered plan, it has currently 7, maybe 8 different age brackets. You know, 0 to 29, 30 to 39, 40 to 49, 50 to 54, et cetera, et cetera. They want to squeeze that down to about 3 age bands. So you have a 0 to 20-year-old bracket, a 21 to 63, and then a 64 plus. So they're going to squeeze that middle bracket. So your 21-year-olds are going to be paying the same thing that a 63-year-old's paying. You know, are they going to try to bring the higher ones down? Those people will probably be saying, yeah, I'll buy it if I have to, you know, if I could pay what a 21-year-old's paying. I don't think they're going to bring them down that far.
Yeah. And
so
how's a 21-year-old who's working at McDonald's because they can't break into the professional market because there are no jobs?
Yeah.
Going to afford that kind of insurance?
And their employer is working them, you know, 29. And by the way, folks, full-time is considered 30 hours a week. So, you know, you're going to have employers out there that's one of my other fears, is you're going to see employers that are going to cut hours so that they have, you know, under the 50 full-time employees. That alone, even trying to figure out your full-time employees is going to be tricky. We're seeing, you know, they're putting out the criteria on how that's going to be determined. You can have a 12-month look back, so you can say, okay, did this employee for the last year, the prior year, actually I think that's going to be 2 years that they go back, did that employee average 30 hours a week for that last year? Wow. And then you can have, you know, a stability period. How long did they, you know, average that? So it's very complicated, and there's so many things for the employer to have to track, to be aware of. It just really has put, with my small businesses here in Chico, a huge burden on them. You know, as their broker, I take on that burden, because they just, no way, they're working to keep their doors open.
Yeah, so how does that work? I mean, say I'm a small employer, I have 3 employees, some work 20 hours a week, some work 30 hours a week, you know, and maybe the other one's 16 hours a week. What would I be required to do for those employees?
Fortunately, if you have fewer than 50 employees, there is no requirement at this time.
Okay, so that I would be unaffected as an employer if I have under 50 employees.
Correct. Okay. Now, one of the things, though, that employers, and I'm not sure if this is going to apply to all employers or just employers that currently offer insurance, but there's going to be a notice. They will be required to let employees know about the California Exchange, and which is actually going to be called Covered California, by the way.
Okay, so that's going to be the new name. And we are going to talk about that right after we take a break. And
we touched on, I just mentioned Covered California is going to be the California State Exchanges, and California is actually only one of only 18 states that has decided to set up this exchange system on their own, where people could go in and get their guaranteed issue insurance. The federal government will be setting up the exchanges in all the other states. And in fact, employers were going to be required to, in March of 2013, start issuing notices to their employees of the availability of all these exchanges. And because there's such an overwhelmingly number of states that are not doing this on their own, the government has, realized, ooh, we aren't going to be quite ready for this yet. Hopefully they're going to be able to do it by 2014. California, under the direction of Peter Lee, has been working on this since the bill was passed almost, in 2010. So we really have a jump on it. So what this is going to allow, it will allow people to buy, as we discussed, insurance, guaranteed issue. They cannot deny insurance, regardless of your health condition, age, smoking, non-smoking status. However, I think it's going to be a lot like Medicare, where they will limit the enrollment period. So they'll have an open enrollment very similar to what Medicare has. Otherwise, I would be setting up my kiosk right outside the emergency room at Inlow Hospital and signing people up as soon as they needed that insurance.
Yeah.
So yeah, there will be some limits on when you can purchase the insurance. The plan is to start having training for agents such as myself and other enrollers, I believe, in March. There will be a certification class that we will need to take in May or June. And then individuals and businesses will be able to see what's out there, hopefully about August, and then begin signing up in October 2013. So this is coming sooner than we think.
Wow.
What they're hoping to do, there are going to be some subsidies available for folks that are at 400% of the federal poverty income level. And
what is that income level? Do you have that?
So it is for an individual, I believe it's just under, well, the 400% is going to put somebody, an individual, just under $45,000, and I believe the family amount is right around, for a family of four, it's about $94,000. So you would think that we're going to have probably 80% of the city of Chico would qualify for a federal subsidy.
Yeah, especially in Butte County, when the average per capita income is about $38,000 for an individual.
Yes, yeah. So but what I've heard is it's not only income-based, there are some other criteria. For example, one of the other board members of the Health Underwriters Association said his son went on, he tested out the little calculator that they had, and he is a college graduate, is making $36,000 a year, and because of other things that he had available, he did not qualify for any subsidy. So yeah, so it's going to be a little complicated. So I know everybody's getting pretty excited that, wow, I'm going to be able to get my insurance paid for. It will also be scaled back. Obviously, if you're at the 400% level, okay, so they may give you, $20 towards your insurance a month.
Right.
Or, so it's
you don't know.
It's not going to be, everything. Don't give up your current insurance. I guess that's my advice to you. If you have insurance, don't give it up hoping that you're going to get it for free through the exchange, because that is not going to happen.
Okay.
Yeah, and they've got some really interesting ways that they're setting it up. They're going to actually have it, I think, going to be based on metals. So we'll have a platinum policy, a gold policy, a silver, a bronze, and then a catastrophic policy. So there's...
It's a copper or
yeah,
nickel
I know. Tin, I think we were saying it's aluminum, maybe, I don't know.
Yeah.
And those are obviously going to be based on, your platinum might have 90% coverage, the, gold 80%, so forth and so on down the road.